everybody. Tom Judd from the Global Clinical Engineering Alliance. I am excited. This is our new GCEA podcast series about CE influencers. Those folks, our colleagues around the world that are making a difference. Clinical engineers, biomedical engineers who serve at the point of care. And hey, I'm going to shut up here pretty quick because I want to get to our influencer, Millicent Alooh. Welcome, Millicent.
Thank you so much, Tom. I'm happy to be here today and looking forward to this amazing podcast that you're beginning today. Yes.
And hey, folks, we want to do this once or twice a month. And so we're kicking off here in early April of 2026 because we've got a lot of stories to tell. Many of you that saw the opening video that we had over 20 countries report in our Congress in China last October, and we're building on that with hearing from Millicent today. So Millicent, first question, at your personal story level, how did you enter the field of clinical engineering, biomedical engineering here at the point of care there in Kenya, although you've got influence beyond that? What attracted you to clinical engineering?
Yeah, thank you so much, Tom. Yes, being about medical engineering is a very interesting career. And one of the things that attracted me to biomedical engineering is that I realized a gap, having born and brought up in low and middle income country, that is Kenya. I realized that there was a very serious gap between medical technology and patient care, whereby I realized that a number of equipment were actually not functional. And I just wanted to ensure that medical technology impacts patient care. So that is actually what really brought me on board. I just needed to see technology impacting life, technology impacting patient care, technology changing lives, and technology making people go home happy and, bringing families back together. Yeah.
Well, Millicent, I want to hear about your family just for a moment because this is personal for you at home as well as at work. And
Yeah,
nice smile, by the way.
absolutely. Yeah, they're fine, Tom.
So, I mean, husband, children, how do you balance all this work that you do?
Yeah, so my family is good. Children are good, and it's amazing because you see from the bringing up children, it all also starts with the technology also at the hospital. So you realize that the babies, pass through the technology. My firstborn baby was a premature and was in the incubator for 2 weeks. And you see, that made me realize that my work is really key because had the incubator and probably the phototherapy units never worked, then probably I wouldn't be having my baby today. But here I am, supporting different families to ensure that their families go back home, and at the same as supporting my family back home. So yeah, the children are good, and yeah, my family is well. My husband is doing well as well. Thank you for that.
Well, those that you read Millicent's bio know that she's really worked in the area of maternal child health, as she just described. I mean, I know that was one of your really key recent jobs that was multi-country. But tell us about, how many years in clinical engineering now and some of the expanding roles you've had over time.
Yeah, so thank you for that question. So I've had about 17 years now in clinical engineering, and I've been privileged to work in various organizations. I've been privileged to work in hospital setting environments where I've been able to maintain various number of devices and experiencing various challenges as well. I've also been privileged to work with multinational organizations supporting various African countries, about five of them, Kenya, Tanzania, Ethiopia, Malawi, Nigeria, and Zambia, among other countries. And I've also been privileged to work with the local distributors of medical devices. So I've really been privileged to work across the scope of biomedical engineering, just experiencing what are some of the challenges and what are some of the ways in which you can improve the system better, especially in low and middle income countries. Yes,
So
and
Millicent,
currently, just to
go
mention,
ahead.
sorry, Tom, currently just to mention that I work at the Mpisha Hospital, which is a tertiary hospital in Kenya, supporting the country as a whole, and then also supporting a number of countries in Africa as well. I'm heading the Health Technology Management Unit, and supporting a number of team members under me, a number of biomedicals under me, about 25 team members, supporting biomedical engineering. So yes, that's where I am today.
So you're kind of senior now, Millicent, but when you first went into your first clinical engineering, biomedical engineering role, what surprised you the most about this field?
Wow, that's a good question. I think what I can vividly remember is I realized that medical equipment problems are actually not due to medical equipment failure. That's what surprised me, is actually due to systems failure. And so when I got in and realized that a number of devices are actually not functional or underutilized, and when I dig deeper, I realized, oh, actually, the problem is not the machines. The problem is not the medical equipment. The problem is the systems. Probably the, poor decision making during procurement, lack of capacity building, or rather training the users or training the biomedical engineers. And it's a whole system issue, policies, and name it. So I was shocked to see medical equipment can actually support the team in Africa, but the systems are not supportive. So that is what really surprised me most. Yeah.
So, Millicent, I want to be quick about this, but you wear a lot of hats. I mean, yes, in your tertiary hospital now, in your five-country program before maternal child health, of course, women in biomedical engineering in Kenya, the AMEC that I want you to tell us a little bit about, your National CE-BME Society, uh, WHO's Strategic Advisory Group for Medical Devices. You've got a lot of skill sets. I think you've already talked about it. What do you think you might be missing in terms of your skill sets that you need now?
Yeah, great. Yeah, so I know I support a number of organizations supporting AMEC, that is the Association of Medical Engineering of Kenya, leading the association in Kenya just to ensure that the biomedical engineering awareness is created across the country. Also supporting the WHO as the START member of medical devices. Also in the country, Kenya also support Kenya Bureau of Standards. I'm in a committee called Hospital Equipment, whereby we deal with the standards and the standards of medical equipment. And recently, I've been appointed to join Kenya National Accreditation Services as a member of committee that is establishing the ISO 13485 for medical devices quality management system. So with all this, and also of course you've also mentioned the women in biomedical engineering. Maybe the only thing that you haven't mentioned is Africa Women in Biomedical Engineering, which is aiming to empower other women in African countries doing the biomedical engineering. So the skill set that I can say I really want to strengthen is probably the data analytics, to be able to ensure that we have enough data to support some of the decisions that we are making, even as a society or as a professional body, so that we can be able to impact various countries and various healthcare systems. So for me, I think that is really, really key. And also one other area is probably the health economics and cost-effective analysis, because health technology management is basically I'm trying to see a situation whereby will not be taken as a cost center, but strategic advisors in the health systems. So if you can be having strengthened the health economics and cost-effective analysis, that would really help. Of course, in addition to the data analytics. Yeah.
And
Thank you, Doc.
I think you've spoken to impact, and this podcast series is about how clinical engineers around the world have made an impact. And I think you're describing both the impact from your current roles as well as where you want to go. Um, in the midst of this, what would you consider to be a key accomplishment besides being a mom?
Yeah, that's interesting. Of course, being a mom is really key. But then in my profession, one of the things that I would really consider as a key accomplishment, having worked at a global level with a multinational organization, I've been able to impact a number of policy making in various countries. We were able to initiate the development of medical devices policies across 7 countries in Africa. So for me, that is really big, and some of them have actually been implemented. Some have been launched and implemented, and looking forward to influencing more. For me, this is really a key achievement, because without policies, then we lack guidance. So I was looking forward to just getting a situation whereby we have countries knowing that even biomedical engineering need policies, need regulation, and that is what I've been able to do. And so many ministries of health actually bought into the idea, and they are working towards that through my influence. So I'm really, really happy that that is taking shape very well in Africa.
I didn't mention it earlier, but since we put the word out about this podcast series about influencers such as yourselves, we've had a lot of feedback from around the world that are pretty excited. Yes, this is recorded today, but this recording will be available on the GCA website very soon, of course, for people around the world to see what you have to offer, which is a lot. Now, hey, we all need training at every point in our career. We all need training to move towards, the goals that we have and the impact that we might make. What's the hardest thing you've encountered that you wish appropriate training was available to help you address? So the hardest thing that you would like training for now?
Uh, Going by the how the technology is moving, for me, I think digital health and AI is something really, really key that every professional, including myself, should really, really be up to date with. So should there be an opportunity for that training, I think I would vouch for digital health and AI, because right now AI is actually doing almost everything, a number of things in health. And I'm looking at a situation whereby even biomedical engineers will be biomedical engineers who are AI literate and empowered just to understand how to be able to employ AI different tools in managing medical equipment or health technology management. So that is one that I would really, really vouch for. Yeah.
Very good. I'm going to give a little advertisement here. You represent an individual member from Kenya that has this broad influence. You're also a part of AMEC, the National Society. AMEC is a member organization of GCEA. There's over 70 countries represented by our members in our organizations, and we want others hearing this podcast to join us and to find out more about that, because those that we're going to feature in this podcast series are those that are members or are part of member organizations of GCA. And like I say, that number is 70, 75 and growing, and we want many people to be a part of that. Hey, if you had a magic wand, and I think maybe you talked about it a moment ago, what would you personally want personally and professionally to enhance our profession, both locally in Kenya, East Africa, and around the world? If you had a magic wand, what do we need? What does the profession need?
Yeah, thank you so much, Tom, for that question. And it's very important because one of the things that I think the profession lacks is effective communication skills. Because a number of times people get opportunities to be on the table, but they never speak. And you see, if you don't speak for yourself, nobody will speak for you. Nobody actually understands what your profession is all about than yourself. So if the profession empowered to really have very powerful, effective communication skills, that would really, really be great. With that, we can be able to speak on the table. We can voice out whenever there's a need to voice out. We can support in decision making across. We can help in impacting in every aspect of the profession. So I think and even the societies, like I know I also associate with various number of societies or rather professional associations in Africa. And one thing that clearly is lacking is that effective communication. Because at times they have an opportunity with a minister, but they'll stay mum. Like they won't voice out. And you're like, why are you not talking about your challenges in your country? And you are in this particular space that you can actually be able to voice them out so that you can be assisted. So if they can be able to be given that effective communication skills and just to know that they can also influence the decision making wherever and whenever, then that would really be great.
One thing about you, Millicent, that I've observed personally over the last 10 years or so that I've known you is that your communication skills continue to grow. And I'm so
Thank you.
thankful for that. I mean, I've seen you do that though at global level on WHO's Strategic Advisory Group for Medical Devices, where you speak up and your voice is heard and you make a difference. And so I think that is great advice. In fact, let's end this questions with one of the young, happens to be female engineers from Uganda that contributed to our Congress, but she's trying to learn. What do you think young engineers such as herself, whether they're undergraduate or graduate, what skills do they most need to help improve their healthcare system? What advice would you give this lady and many others like her?
Yeah. Thank you so much, Tom. So, one of the things that I'm looking at for the young engineers is looking at themselves not as equipment fixers, but as people who are solution givers. So if they can carry themselves as solution givers, especially the young engineer who is asking that question from Uganda, then I think they would be able to go far. And giving solution cuts across from when you start your career, going all the way to when you are employed in a HTM organization. I didn't mention that I was privileged to be awarded the HTM Leadership Award by AME in 2024. And one of the things that pushed me to that level was just ensuring that there was a lot of capacity building that I was giving to the team across, and just ensuring that we do the right things at the right time. So going back to your question, the young engineers, I would really, really strongly advise that they see themselves as solution givers, but not equipment fixers. And looking at the decision I made to come back to the hospital after leading, in a multinational organization, I was looking at how I've had it out there. I've seen what's going on out there, and I want to set a health technology management system in this hospital that can be used as a role model, rather, where people can actually come and see this is possible. I'm looking forward to seeing people streaming all the way, not only in Kenya, but across in Uganda, Tanzania, coming to see the kind of systems that we are having at Mpisha Hospital. And that is the main reason as to why I decided, let me settle back to this organization to see how can I implement all that I've gathered out there when I was working with this multinational organization. So to the young people, what I can say is that it's really, really doable. It's all about really being very focused on what you're doing, and learning never stops. I think I still learn today. I learn and learn and learn and learn every single day. It never stops. Thank you, Tom.
The Millicent, wonderful interview. You have impacted health technology management, clinical engineering, locally and globally. But not only that, and maybe people didn't hear it well, but you were able to get the Global Leadership Award from AAMI in 2024 as a young global leader. And you're a mentor, is the new point I want to make. You're mentoring others. You're not only creating models, but you're mentoring others. And we so appreciate that lifestyle that you have in clinical engineering. Any final words for us?
Yeah, so I think maybe the last word that I can say is that to anybody and to everybody watching this, I think for the clinical engineers, we need to really just not think like technical team only, but let's also try to think system-wise as well. Let's have some kind of system thinking so that we can be able to influence the systems, because the only thing that changes the entire profession is system. If we can go beyond just technical foundation and learn more of system thinking and problem solving, I believe that will really, really take us far. And probably just developing some of the very good communication and leadership skills wherever we are, that would really, really help us to ensure that this profession goes beyond what we are seeing today. And I'm really looking forward to a day when the health, the clinical engineering will be having a very well regulated profession. The regulatory framework is in place, the policies are in place, and things are flawless when it comes to the clinical engineering. That is what I'm looking forward and looking towards seeing every biomedical engineer, every clinical engineering, wherever they are, advocating for, to see the policy framework, the regulatory framework, and everything is in place, just the way other cadres in medical like doctors, they have very good things. Their frameworks are in place. Nurses, why not biomedical engineering? I'm looking at a future with good framework for clinical, biomedical engineering, and health technology management. Thank you, Tom.
Thank you, Millicent, and thanks from Africa. And hey, folks, coming down the pike is Jose Domingo San Martin from Spain, who will talk about Europe. And of course, our deeply esteemed and beloved Adriana Velasquez talking about clinical engineering around the world in future podcasts. So thanks from GCEA today. Bye for now.
Thank you so much, Tom. I do appreciate the opportunity to be here today. Thank you. Oh.